Good afternoon, everyone. My name is Hoyan Trong. I'm a member of the Academy as well as co-chair of the Hill Visit Subcommittee for Training, which is a subcommittee of the Hill Visit Training Group. It's my honor and pleasure today to serve as a moderator and to help monitoring the question. Our speaker today would like to thank our three speakers, Dr. Haynes, Dr. Power, and Dr. Cochrane, who will share with us about the some tips for Hill Visit, our 201 session. In case you missed our 101 session last week, you can visit our website, which will be provided later toward the end of this for a recording of that, as well as the site for the following, which is the final in the series 301 next week. But more on that later. Without further ado, I would like to introduce our speaker and turn over to Dr. Haynes, Dr. Power, and Dr. Cochrane.
Thank you, Melanie and Hoyan. Good afternoon, everyone. Thank you so much for joining us. And first and foremost, happy Valentine's Day. Hope you all are having a great day. And again, welcome to the National Academies of Practice 201 Advocacy Webinar. As was mentioned, this is the second in a series of 3 webinars dedicated to develop and prepare you for the Hill Visit or Advocacy Visit to come just around the corner as part of this year's National Academies of Practice Forum. Next slide. So today, we're actually going to be bridging content from what was already shared for those who were able to attend or already listen to the recording from the 101 webinar, which in essence encapsulated first a definition of advocacy, developing a plan of action and how to go about doing that to prepare for a Hill visit. They touched on some of the to-dos and some don'ts to help ready you for the visit. And then some time was spent giving some information regarding some follow-up recommendations, how to send communications and follow-up to staffers and legislators we hope that we'll be visiting with as we spend time on the Hill. And today, our goal is really 4 key elements. The first is to review with everyone who NAP is, so who the National Academies of Practice is, some of the rich history around our association, a little bit of a weaving into the spotlight around the quadruple aim as it's very relevant for our messaging on the Hill this year, how interprofessional education advocacy differs from perhaps your past experience for those who have been to the Hill before, representing your own distinct discipline, and then a little bit more detail preparing you for the Hill visits in terms of some helpful logistic reminders. Slide. So although many of you have experience, as I've mentioned, on the Hill, advocating for your own distinct professions and member organizations that you serve, we are working together, like-minded individuals who seek to demonstrate the value of interprofessional education and collaborative practice. So again, that begins our central focus or our central tenet around the messaging that has been prepared for us to share to staffers and to our legislators. Next slide. So I'm sure you also recognize the key definition from IPEC regarding what is interprofessional collaborative practice. So essentially, interprofessional collaborative practice occurs when multiple health workers are learning from working with different backgrounds, so bringing our distinct disciplines, coming together, providing a comprehensive service to our patients, including their families, caregivers, communities, to deliver the highest quality care across settings. So at the cornerstone of what National Academies of Practice embodies, obviously interprofessional collaborative practice is essentially that. Next slide. Additionally, also well known to folks joining today, but still important to highlight are the 4 competency statements or domains that we're all familiar with that shape how we prepare future practitioners, train our students and residents to be team ready and practice ready. So essentially, when we look through these competency statements, what resonates to you, I'm sure, as we also look to this image to your left, is that we deliver patient-centered, comprehensive, interdisciplinary, holistic care. So thinking about values and ethics, roles and responsibilities of the team, how we communicate with one another, and that we work together to develop a care plan, follow-up and monitoring, and working on our best behalf, whether it's population health or individual health, to the better health outcomes for our patients. Now I'm going to transition over to Teresa, who will now lead us through a transition talking more about the National Academies of Practice, its rich history and structure.
Oh, Teresa, I think you're on mute.
So who are we as NAP, as the group of the National Academies of Practice? We're a professional nonprofit association, and it consists of healthcare professionals across 14 disciplines that are committed to advancing interprofessional healthcare. NAP formally began in 1982, and the purpose was really to assemble an interprofessional body that would set aside turf issues and could be trusted to advise Congress on what is the best healthcare for the American people. There are associate and professional members and emeritus members of the National Academy of Practice, but its highest membership category is considered the Distinguished Fellows. And this is a collection of the people in their 14 respective professions who have expertise in interprofessional education and practice. And they've been recognized by their peers as having made some significant or enduring contributions in the practice arena, in scholarship or research, or in the area of public policy. And this is important because the NAP members, our role is really to foster collaboration among the healthcare professions to advocate policies that are in the best interest of the individuals and communities. So along with that, we also consider the Institute for Healthcare Improvement, the IHI. And that is an institute from the early 90s, late 80s, early 90s, that it's an institute without walls. And that point of that group is to kind of work as a cohesive unit with common knowledge, common systems, unconditional teamwork, in which all teach and all learn. Now, the IHI developed the triple aim in 2008 as a guide really for new models of health service delivery, healthcare delivery. And the focus of the triple aim was to improve the patient experience, improve population health, and really decrease or contain per capita costs. More recently, the last couple of years, we've added a fourth area. Now it's called the quadruple aim. It's still somewhat controversial, the fourth piece is, because it's not directly focused on the patient. However, the quadruple aim has added experience for the providers, the clinicians and providers. And when you consider rates of burnout, attrition, suicide in some of the health professions, it's really hard to argue that ensuring a healthy workforce is not an essential substrate to providing quality care. So now we do speak of the quadruple aim and considering the provider experience as well in those other three areas. Now, while we won't have, NAP won't have a specific piece of legislation for which we're asking support, this round anyway, NAP is emphasizing the quadruple aim because team-based care can enhance outcomes in each of those four areas of the quadruple aim. And so besides the provider experience and cost effectiveness, team collaboration enhances access to care. And this is especially important during transitions of care where patients can fall through cracks in the system, in the healthcare system. And the fourth area, outcomes, can also be enhanced, whether the outcomes are measured as a faster return home, whether we're looking at lower readmission rates to hospitals for the same diagnosis, whether we're tracking functional status or quality of life for patients. The patient outcomes are also enhanced by team-based interprofessional care. Team-based care doesn't always have to be the model exclusively for every patient seeking healthcare, but it's especially critical and important for patients who are complicated, have a high level of chronicity or high risk. Because those things really require expertise and vigilance of multiple health perspectives in trying to focus on good outcomes. So that quadruple aim will be an area of emphasis for NAP's legislative initiative this time. Now, NAP's central mission, again, we really are trying to advocate policies that are in the best interest of individuals and communities. I mentioned NAP is dedicated to lifelong learning from, with, and among the different health professions. And I've also mentioned that our Hill visits aren't tied to a particular piece of legislation right now. It's not a specific ask, but the whole purpose of the National Academies of Practice is really to link arms with the other health professionals to support policies that facilitate interprofessional education and clinical practice based on, and in addition to the quadruple aim, to improve outcomes for the people we serve. And so NAP's whole point of supporting affordable, accessible, coordinated, quality healthcare for all is really salient in our initiative. And finally, again, although NAP doesn't have a specific bill on the table at this time, our messaging can emphasize such things as the importance of developing legislative champions for healthcare access reform, workforce development, focusing on interprofessional education and practice because that touches the healthcare workforce and affects all Americans. And emphasizing the interprofessional approach can knock down some of our disciplinary barriers and turf issues and help build bipartisan support. And this approach, really, the interprofessional approach to lobbying is relatively new, and it emphasizes the significant system-wide needs, the needs that really require a unified voice across our health professions. So now with that, I'd like to turn it over to Tom so he can provide some more detail about the Hill visits.
Okay, thanks. As you see, one of the things in terms of Hill visits, as mentioned earlier, many of you may have already done these as a part of your specific discipline, or maybe I'm part of some other nonprofit. But what's important is, as you see here, the power of storytelling is to have a story and to have a message that we are trying to provide to the people we're going to meet with on the Hill. The first one is to have an importance of their own discipline voice, and that is to know what you want to talk about in regards to your own particular discipline, whether it's nursing or my case would be audiology, but couch that, if you will, in the spirit, if you will, of the entire NAP, and that is how that discipline then works and begins to provide that transdisciplinary practice. It's important that we all understand that there's many different kinds of models of integrated care that we're trying to promote here, both group and disease specific, as well as population-based models. It's important that we bring those things together so that it doesn't seem like there's just one voice coming out. As you probably may know or you will hear, we're going to try to group people from different disciplines together in these Hill visits, going as groups, so 2 or 3 from the different disciplines within NAP. And so that way each one will have the opportunity to have a discipline voice, as we may call it, as well as then a NAP voice, if you will. Working as a part of a cohesive unit on behalf of the patient is an important part of the messaging. Teamwork, obviously, is another integral part. And the last part, which supports the messaging you already heard, is to develop both team-ready and practice-ready graduates. Another important part of the NAP mission is not only for those that are already working in the individual disciplines, as well as in transdisciplinary or across practices, but also to make students aware of this type of approach to healthcare and have them ready to participate in it when they are ready to get out and start their first, second, and hopefully multiple jobs across their career. So if we move on to the next slide. You see here some of the specifics about the Hill visits. They will take place on March 7th. Part of the goal is to educate lawmakers and staff about this interdisciplinary approach and this collaborative practice. As you see here, the teams will be formed from 3 or 4 NAP members and blended constituencies across as much as possible. Hopefully we'll have enough folks who have signed up and want to participate so that that's possible. Because I think it then provides a more broader voice to the people that you will be meeting with. And as you see here, Prime Advocate, who's going to be sort of helping coordinate and do the scheduling. There will be talking points that they're going to provide sort of as a brochure, and also some information that you can leave behind with the staffers that you will meet with. We're hoping that these will be available prior to you arriving for the Hill visits. At least that's the goal as of right now. We hope that that's going to be able to take place, but at the very least you'll get those prior to going to the visits. There's also a potential for us to have a vehicle that you'll be able to record your notes following each visit. I think that that's an important part of being able to share the information that's gathered as a part of these visits when we all sort of get back together, and so we can begin to see how the staffers reacted, what their questions might be, which then would lead to what might be changed or updated or modified or improved for the next round of visits. So again, we hope to have that to everybody who's going to make Hill visits ahead of time, but at the very least, you'll be getting that when you arrive for the visits. Next slide. So I guess what's important for those of you that will be doing these visits is to review the information that you're going to get from Prime, as well as the NAP materials, so that you're ready to prepare and have your story and your elevator speech ready. And it's really important that this happens. And again, those of you that have done this know that these are not very long meetings. If you get 10 or 15 minutes with the staffer, and they could get very lucky and also meet with the lawmaker, whether it's congressmen, senators, or from the House. But typically, most of these meetings take place with their staff, and typically the staff who are handling the health and healthcare related policy for that particular legislator. So they want to get very concise information about what it is, to the point. So again, each person will have their discipline voice, their NAP voice. You want to have everyone make sure that you have plenty of business cards to exchange so that they have contact information if they have follow-up questions. Again, the materials and brochures will be available for you to leave behind. It may sound funny, but wear comfortable shoes. Congress is a big place, and if you haven't been there before, it's a long way from one side to the other, and if your two visits are on either side, it could be quite a haul, and literally sneakers are maybe an appropriate vehicle, or at least something that looks comfortable shoes that you can get around in. There's nothing like running through the halls and uncomfortable shoes, or for the ladies' high heels. That is just going to be a real tough thing, because these are tough to schedule door to door, next door to each other, and it's very uncommon that you would not have to hustle between the visits. There will be a debrief to follow. So in all of these, what we want to try to do again is gather all of the comments, materials, questions that come from the staffers at each visit. Then all of those can be brought together, and we'll see what their reaction is. And again, those will be used by NAP as well as the Prime to develop future materials and/or visits to the Hill. So next, I guess, is really if now I think there's time for questions, if you have any. I think we've been reviewing the chat room, so I think I'll turn it back to you, and you can go through the chats. I see it's orange, so there must be something down there. Go ahead, John. I think you're on mute.
I just had unmute. All right. Well, thank you. We have at least two questions. I'll start with the broader question first. The question came is, how can someone like myself, as a first-timer, contribute to the Hill visit in a meaningful way? So I just mentioned real quick, and then also read for the panel also. the important thing is building relationship. The first time you build a relationship and make yourself available as a resource for your legislator, like Dr. Tao just mentioned, leave your business card behind so they have questions about interprofessional, about patient-centered care specifically to contact you as a resource because they want to hear from all of us collectively as a healthcare professional expert. But any other panelists have any other insight? So that's the first question we received.
I would certainly reiterate just what was mentioned. I think what I would add is something that was also shared just before, which is about the storytelling and the power of storytelling. So if you have an experience where you already are or have been working transdisciplinary, interdisciplinary, sharing a story of how that has impacted a patient's life, families, or caregivers would definitely resonate in connecting that human condition to what we do.
I can't agree more. I think that those kind of stories really, tell the story of what NAP is all about. I don't, if we were there to cover a particular piece of legislation, then it might be a little bit different because you'd be talking about why you're supporting the bill XYZ. But in this case, I think it's more to raise awareness and to get them thinking about this approach to healthcare, and that's really the most important part. So it really is about the story from each discipline and also the interdisciplinary part of it. So don't be afraid if you're a first timer. Somebody always has to be one.
Any other comment from the panelists? All right, hearing none, the next question we have is a little bit specific. Basically, it's regarding any specific legislation that we support. And I think that because of the specifics of this question, I have chatted with Melanie. She'll follow up with this individual, very specific piece of legislation. So we won't address that. But I would definitely want to invite you to 301 to hear the follow-up to this webinar. So are there any other questions?
Hoi-An, I see one other question that just came in.
Sure. Question is, do you have any idea how many appointments each team may have?
And this is Melanie. I can probably address that. I've been working with Prime Advocacy and sending them our list of registrants for the Hill visits. And at this point in time, we anticipate that each group may have 4 or 5 meetings throughout the day. So you will get those schedules you will get them the morning of the Hill visits. We're working with Prime to see if we can get those schedules out to everyone a couple days beforehand so that you know who you're grouped with and also who you're meeting with as far as legislators, to give you a little bit of time to do some high-level research on them. So we are working toward that, but at the very least, you'll get them that morning, and we'll have time during the breakfast briefing for you to meet with your group and discuss with them your strategy for how you're going to conduct your meetings.
Right. Well, thank you, Melanie. We have a comment and then another question also, but I'll take the question first. What is the easiest way to get to the Hill to take the metro? Is that the easiest way to take to the Hill to take the metro? And I think maybe a question for you, Melanie, too.
Yes, and we are relying on all of you to make your own way to the Hill. So transportation choices will be up to you, but we will provide information for you as to your options. And definitely the metro is a very convenient way from our particular hotel. The Ritz-Carlton, there is a metro station that's very convenient to get to the Hill that way. Of course, there are also taxis, there's Uber, so there's other choices as well, and we'll give you information on those options.
Thank you, Melanie. While we're waiting for a further question, there's a comment here. I'm sorry, did someone about to mention something?
I was going to add one thing. It's probably going to be included on the materials, but if you're using a non-metro option, just plan a little bit of extra time, because DC can be a little crazy if we have new folks who haven't visited or gone to do Hill visits. The traffic can be a little unpredictable and certainly worse at certain times of the day, depending on when the visits are scheduled. So just keep that in mind. Sorry.
And just a follow-up on that also, because we have, as Melanie mentioned, we have bus, so please make sure you register so we can plan accordingly. If you have not had a chance to register, please register as soon as you can. We have a comment. This was a wonderful presentation. Thank you for taking the time putting this together for us. So kudos to the 3 presenter panelists for that. Thank you for that. Any other questions or comments?
I would make one in regards to the visits too, not only the traffic, but remember there's probably going to be some security issues that you're going to have to go through when we get there. So if your appointment is at 10, I would encourage you not to think you can get there at 5 of, because there's going to be a gazillion other people also seeing legislators on a bunch of other topics, and to get in takes usually some time. So, you know, I'm sure that'll be covered in the briefing, you know, that morning, but just as you plan, you know, your time and day, there is a certain amount of logistics to getting through and in there, so.
Mm-hmm. Thank you, Thomas. I see. Next question is, when will Advocacy 301 be available? Right on our very next slide. As you can see right there, stay tuned for our next webinar next Thursday, February 21st at 3 p.m. Eastern Time. And in addition to that, just a reminder that the recording for today's 201 session will also be on the website, as well as 101 from previously. Seeing no further question, are there any departing thoughts from the panelists?
Thank you all for attending, and we're glad this is informative, and we look forward to engaging with you, perhaps not as a very group with you on the Hill visit.
All right. Yep. Thank you. And once again, just a final reminder, please go to the NAP website to check for recording as well as register. It's very important for you to register, help us to plan accordingly. If you have any questions, you can always email Melanie, or you know, she will be very happy to help you with that, and look forward to seeing you on the 7th. Thank you all.
Thank you.